Am I a candidate for follicular unit extraction? Hello, I'm a mid-30s male doing some prelim research on hair restoration options for my temple area. I'm attaching a current photo of my hairline, which seems to have stabilized at its current point. And, for whatever it's worth, it is almost identical to my 65-year-old father's. FUE strikes me as a very interesting option. In short, I'm wondering, does this seem like a reasonable goal? Could I do this without finasteride? I'm risk averse regarding sexual side effects, even if rare. Thanks.
Thank you for your question. You're in your mid-30s and you've submitted some photos very nicely showing the extent of your hair loss. And you describe in your question the similarity in your family hair loss pattern. You've also asked questions about follicular unit extractions, in other words, a surgical hair transplantation, and a way to hopefully avoid taking finasteride, since, as you've done your research, you have discovered concerns about long-term sexual side effects. So I'm going to share with you the approach that we have in our practice with people like yourself, mid-30s, with a similar hair loss pattern. And I think you're going to learn something that will be of benefit. And so let's start with just understanding your hair loss pattern. At this point, you have a relatively high temporal peaks. In other words, the receding hairline goes in the temples and goes upward, and you can see a lot more of your forehead. Your frontal hairline, the central part, is not bad, but it also appears to be receding. So when you think about a surgical option for hair transplant, there's something that you always have to factor in. And that important part is factoring in the progression of hair loss. Right now, with hair transplant surgery, there's a lot of interest in follicular unit extractions, a method of transplanting hair from the permanent zone, the zone in the back of the scalp, which never goes away, that you can move hairs and place them in areas where you need hair. Now, whether you use the strip method or follicular unit transplant, FUTs, or FUEs, follicular unit extractions, you still have one big limitation, and that limitation is the donor area. In our practice, for years, we performed hair transplant surgery. And in the past several years, we have developed a method of restoring thinning hair called hair regeneration. Now, hair regeneration is a method of using platelet-rich plasma combined with a material called acellular matrix. And when combined in a certain way that is customized, and then we apply it in a very specific dosing depending on factors including age, gender, degree of hair loss, we have found significant improvement in being able to halt the progression of thinning and reverse the thinning process. So how does this fit in to the grand scheme of what to do about getting the look you desire? Well, what we usually counsel our patients about is, after understanding that hair loss is ongoing and that the hair donor area is limited, it stands to reason that you want to do everything you can to prevent progression of hair loss, and if the opportunity comes up to be able to reverse thinning of hair, then you've achieved a certain level of stability and predictability. Very often we see people who have had several transplants over several years, but at a certain point their hair thins out and all they're left with are transplants. And many of these patients who had these transplants done very aggressively to try to build up a frontal hairline when they were younger when they're older, unfortunately have what we call the pluggy look, the look of isolated plugs. So I think that we have made a tremendous impact on the choices that many people are making about if and when to do a hair transplant. In fact, it's not unusual now for people to come to us who have had a hair transplant relatively recently, and they'll come in to have the treatment in order to not only prevent the progression of hair thinning, but also to enhance the survivability and the results of the transplant. This material that we're using was originally designed for wound healing, and as such, it has shown tremendous benefit in our practice and when people come from the outside who have had transplants done elsewhere to enhance the results of their transplant, improve the healing of the donor area, as well as reverse the thinning process so that the overall volume that you're able to achieve is significantly greater. So, in fact, a lot of our patients, in addition to that scenario where they've recently had a transplant and they're coming in to enhance and maximize the results of that transplant, a lot of people are also learning about us and are ready for a second transplant. And when they think about going through a second transplant, they start researching and making decisions about other options. And when they come across what we do, we found that a lot of people who have considered a second transplant, when we place the microscope on their scalp, they see that they don't have necessarily a lot of hair loss, but they have a lot of hair thinning. And so essentially, as long as the hair is still present, then we could potentially thicken significantly the hairs that are thinning. So what does that mean? Well, we basically were dealing with very simple numbers. In a given area, if you can thicken up hairs that are thinning, then the volume effect and the scalp coverage, I would argue, is considerably greater than a hair transplant surgery because their numbers are just higher. Nature has put the hairs much closer together in particular clusters, and no matter how technically skilled the surgeons and technicians are on a hair transplant team, we can never create the same level of density as nature, especially with one transplant. So now hair regeneration has become another option for people who are considering a second transplant. So I think that in your situation where you've already have essentially, like many of your contemporaries, want to avoid finasteride because of the fear of sexual side effects, then consider a stabilizing alternative such as hair regeneration as an option and in a strategy. What we do in our practice is we explain that a given patient can have a full result benefit from hair regeneration from anywhere from a year to 18 months. And what we do is we follow our patients every 3 months after we do the injection. We document with standardized controlled photography in specific positions and microscopy, looking at the scalp with a microscope and documenting the progression and improvement. Once we reach a certain maximal reversal where most of the hairs are terminal or good quality thick hairs as opposed to miniaturizing or villous hairs, then we can make a decision. And usually when we are up to a certain point, depending on the level of hair loss, if we choose to move on to have a transplant, we can be so much more strategic and more effective in the placement of these limited numbers of hairs and place them more effectively to get a very nice cosmetic result. So I know we diverged away from your initial question about whether or not FUE is a good choice. My my position on this is hair transplant can be delayed if we can reverse the thinning, and in many of our patients, they don't even feel like they need to have a hair transplant after they have hair regeneration because they're comfortable with their look. So I think this is bringing to the forefront another option in the treatment of hair loss. So my recommendation is continue doing research, learn about options before you move forward with any kind of surgical procedure, learn about hair regeneration, and hopefully you'll be able to make a decision that will get you the best results possible. So I hope that was helpful. I wish you the best of luck, and thank you for your question.